I wake up this morning and I see this news is this MEC of Health in Gauteng talking literally nonsense. Totally talking nonsense about our country, talking nonsense about our people.
And there is this notion that everybody that gets there who comes from foreign countries is not paying. It's not true. Not everyone is not paying. It's like the South Africans that you come, some come, they don't have money, but we make arrangements even for anyone that comes to our institutions who doesn't have the 100 rand to pay or 20 rand if it's 20 rand to pay.
She must give us the countries that she's saying they are paying for medical care in our country. We cannot accept this. The ANC must deal with this woman. It is a crime to assist a criminal. It is a crime to assist somebody who has broken the law to get in our country illegal. That person is a criminal.
You speak Shona. And then how do you find yourself in Villa and Malala when you are supposed to be with Munangago there? You know he doesn't give me money to operate you guys. And I'm operating with my limited budget.
Now Ghana has realized that they need to fight for their country. Ghana is fighting for their country. Sooner or later they'll be calling Ghana xenophobic. There's no xenophobic there.
Please, no one should now start getting upset and saying, as South Africans, they're chasing, they have tried. As someone who was in South Africa, who lived, who schooled there, who did some things there in South Africa, I will say, I gave birth twice in South Africa. Twice. I had 2 children in their government hospital via CAS, 2 CS operation, cesarean. I did not pay 1 cent. 1 naira I did not pay. I gave birth to the second child. The same thing. I was given food 3 times a day, free food.
Good morning, good afternoon, good evening, depending on what watching this video. You could be watching from South America, you could be watching from North America, you could be watching from Asia, you could be watching from Australia, you could be watching from Europe, you could be watching from Africa, the mother continent, you could be watching from the Caribbean, you could be watching from anywhere around the world. It could be the first time you bump into my face, it could be the first time you bump into my voice, it could be the first time you bump into my YouTube channel. My name is Hlulani, the Tsonga Prince from South Africa, from Zanzibar for sure. You're probably asking yourself, what am I doing here? I'm here to talk about what's happening around my country. I'm here to talk about what's happening around Africa. I'm here to talk about what's happening around the world. But most of all, I am here to come and defend my country from those who think they can come to our country illegally. I will be the first defense force. From those who think they can come and corrupt our country, I will be the first defense force. From those who think they can come and work in our country illegally, I will be the first defense force. From those who think they can come and sell a white powder in our country, I will be the first defense force. More than 77% of you guys are watching my content, but you have not subscribed to my YouTube channel. I don't know what you're waiting for, guys. So kindly hit that subscribe button. Don't forget to hit that notification bell so every time when I upload my video, you are the first one to get my videos. Because don't forget also to hit that join button, become a member, and contribute to this channel so that I can continue to grow, guys. I need many of you guys. So less than $2 or less than 30 rand, you can become a member and support this channel, and so that we can continue to grow, guys. We're almost reaching to that 20,000 subscribers. So I need you guys. I need many of you. I know we are getting there. We are getting there. So I need many of you guys. So just continue to hit the subscribe button. To subscribe, it is for free. It's only when you hit that join button and you become a member is then when you can able to contribute, and anything that you can contribute from those 3 packages. So you can choose those 3 packages that you want to contribute on those 3 packages, guys. And don't forget, guys, to share the video. Are you sharing the video? Share the video so that we can continue to fight and expose all these criminals who are destroying our country. Because if we don't share, we are not working hard. So let's continue to work hard, guys. I also want to say thank you to my returning subscriber. I also want to say thank you to you who just subscribing right now, because I know, guys, you are hitting that subscribe button. Did I say thank you to my returning subscriber? Yeah, if I didn't say it, so I just want to say thank you to my returning subscriber, guys. Let's get back to this video. This video, guys, I wake up this morning and I see this news is this MEC of Health in Gauteng talking literally nonsense. Totally talking nonsense about our country, talking nonsense about our people. No, I don't want to lie to you. If there's one thing that make me sick. It is South African calling South Africans that were xenophobic or mentioning the word xenophobic. Maybe she should tell us in her mother tongue, what is the meaning of a xenophobic? Please translate that in your mother tongue, because let me tell you, there's no such things like that. It does not exist. There's nothing called xenophobic. Maybe come to a comment section. Maybe somebody must tell me what is xenophobic in your mother tongue, because that thing does not exist. I don't want to lie to you guys. It makes me sick when I see another South African, when they know exactly that in this country there is crisis. We are under attack by criminals, and they want us not to speak. It's sickening to see this woman come to social media, come to national television, and speak such dangerous words, reckless words about our people. We cannot accept this. She is a sellout. Let me tell you guys, you cannot defend the ANC, you cannot defend the DA, you cannot defend the EFF, you cannot defend the FF+, because those four parties, guys, if you defend them and you don't look stupid, I don't know. You cannot defend them. How do you defend this type of MEC? If you watch that whole interview, guys, I watched the whole interview. There's some points at some interview. She wants us to praise her. She thinks that she has saved this Department of Health in Gauteng, when she knows she's talking literally nonsense. She's talking nonsense. We cannot accept this type of behavior. This type of sellouts, we don't want them in our country. She's busy with these human rights criminals. These human rights criminals who are destroying this country with the criminals who are coming to our country illegally. And we must supposed to keep quiet. She's busy with these NGOs. So guys, the ANC is selling out our country. Let us be honest. Look, guys, even when I want to defend them, I've been voting for the ANC for a very long time. I cannot defend these people. I just cannot defend them. I cannot defend them. But let me play you a clip so that you see what I'm talking about. Because some of you probably think I'm talking nonsense, but let me play you this. I'm going to play you 3 clips, guys, just to prove to you that she's talking nonsense. Because the other MEC, not long ago, she was talking about what the Zimbabweans are doing to our country. But let me play you this clip.
Around South Africa having agreements with other countries around how to deal with the pressure that is being put on the public health care system.
Mm-hmm. Yes, we do have those agreements, as I was indicating, and some of those agreements, the countries are paying, but individuals that come on their own accord in the hospitals, they do pay too. And there is this notion that everybody that gets there who comes from foreign countries is not paying. It's not true. Not everyone is not paying. It's like the South Africans that you come, some come, they don't have money, but we make arrangements even for anyone that comes to our institutions who doesn't have the 100 rand to pay or 20 rand if it's 20 rand to pay. So there is no such. That's why I always say people sometimes must stop telling stories that they don't have facts about it. They must come so that we're able to explain to them. But again, the Constitution binds us to those colleagues that are coming to the institution. And if you know what these people do sometimes, they just arrive straight to the clinic in the morning, and that person is heavily pregnant. She must be taken straight to the theater, if it's a theater, or to the ward so that they can be treated. So it's an emergency cases, some of those people that come. So that's why I get worried when people turn them at the gate, because once it's an emergency, that person, you don't have a choice then. You can't stop that person. And it's not right what you are doing of violating other people's rights. You bring cameras, you do everything so that you can show off that indeed you are turning them back. But I'm happy now because there are discussions that we're doing even amongst our NGOs in terms of how do we handle this issue. We had a meeting with the Human Rights Commission where it was easier for us even to explain to the Human Rights Commission that this is the situation where we are and how do they feel, including them as commissioners. We are going to come up with plans now, but not only Human Rights Commission, all the other interested parties in the country. We must have a discussion on this issue. We must resolve it, all of us as South Africans, because we can't be seen again being xenophobic, targeting specific nations so that they can't get these services.
It's sickening, guys. You cannot make up these stories. You just cannot make up. You just cannot. She must give us the countries that she's saying they are paying for medical care in our country. We cannot accept this. The ANC must deal with this woman. We cannot have old wrinkled women coming here and talking nonsense. Not long ago, I mean, the Minister of Health, which was Poppy, she told us there's nothing that these countries are giving us. And we all know that there's nothing that contributes. She must tell us which country is contributing. And she thinks that if these people are charged 20 rand or 100 rand, that makes anything. We as South Africa, we must go stand there in the queues and the whole day. Sometimes we don't get help because there's illegal foreigners sitting with us. Those illegal foreigners must be arrested. Anybody who assists any illegal foreigners, you are part of this nonsense that is happening in our country. It is a crime to assist a criminal. It is a crime to assist somebody who has broken the law to get into our country illegal. That person is a criminal. That person must be treated as a criminal. You can't treat that person anyhow. That person must just be treated as a criminal because that person is a criminal. Every country will treat you like a criminal. What should we call these people? They are criminals. When they say you are illegal in the country, it does not matter where they find you. It should not matter. It should not matter where they found you. They found you at the hospital, they found you at work. If you are a criminal, the same way that we're busy removing these people in these factories where they're working, they're getting arrested, they're getting deported back to the home country. You get them in the hospital, they must get arrested, they must get deported back to the home country. We don't want them in this country. We cannot be assisting these people. We cannot be assisting criminals. We're simply saying they must go to a private hospital. How many times are we going to come here and say these people must go to the public? Why are they forcing to use the free public health care? Why are these MECs forcing? Why are these leaders of the ANC forcing? What are you getting from these people? You must tell us, what are you benefiting? Now you are lying, you say countries are paying. Give us those countries that are paying MEC. Give us those countries that are paying. Because it's a lie. Let me play this clip, guys, to prove to that. Whatever she's talking nonsense. Let me play this clip. This clip has been circulated for many years, and this minister, which now she's a premier, she was in trouble because of this. Because people criticizing her. Who will still stand with her? Who will still stand with her? Not with these sellouts. These sellouts who are there in Gauteng. You are selling out our country. We go to these countries, we don't get any assistance. Why do you think when they come to this country, now we must become mini gods? We are not mini gods. It cannot be that when we go to the country, we are not assisted. There's no one who give us free health care. We pay for medical care when you go to the country. They even require to have a medical aid when you go to their countries. Why do you think when they come to this country, they will just come and do as they please? But let's watch this next clip, guys.
First one. When I was guy. You speak Shona. And then how do you find yourself in Villa and Malala when you are supposed to be with Munangago there? You know he doesn't give me money to operate you guys. And I'm operating you with my limited budget.
Thank you so much.
Well, you can't appreciate that. You're killing my health system. You are killing my health system. When you guys are sick, I'm hearing these days, you just say, let's cross Limpopo River. There's an MEC there who's running charity department. It's not. And I'm going to tell you something that is truthful and painful. You know Stats SA goes and count people during the census and tell me that in Limpopo you have got 5.7 million people. And tell me out of that 5.7 million, 91% do not have medical aid. They are dependent on the state. 9% they will say has got medical aid. They depend on private hospital. And then they go and give National Treasury. When National Treasury allocates its budget, they said Limpopo has got 5.7 million people, and they subtract the 7%, 9%, and they give me the budget of the 91 to do all these operations. Now, I am here, instead of using the budget for what it's meant for, I'm operating for what Mnangagwa is supposed to do. And that is why when my people of Limpopo want health services, they can't get. And that is angering the community. Because you are coming here to, I was in George Masere. We are busy operating Mozambican national everywhere. And you are not even registered anywhere. You are not counted. You are even illegal. And you are abusing me. This is unfair. It's unfair. I can't go to Zimbabwe and get health care. Do you think they can allow to operate me? It's for their own people. I went to Canada recently. You know, before I entered the country, I must show, before they give me a visa, I must show them that a proof that indeed if I fell sick in Canada, I'll be able to cater for myself. It's only in South Africa where people just come in. And people have got problems with Minister Mtwaledi. You know why he's like this? It's because he was working in health and he knows the pain. And people call him xenophobic to say he's anti-Zimbabwe. He's not anti-anybody. Minister Mtwaledi was feeling the pain. I used to go with him to Musima to see the problem there. So, says, you won't be discharged until you settle your bill. You must charge him. CEO.
Was she wrong, guys? When she stand for this country, now we've got these MECs who are talking nonsense, telling South Africans that their country's pay. She must tell us, because it's possible that herself and herself and some of this GNU are busy benefiting when we are suffering in this country. When we are busy suffering in this country, when our people are suffering in this country, they're busy stealing the money, because she has came out and telling us South Africans that they pay. And here is the Minister of Health, when she was a Minister of Health, telling there is no money that we're getting from anybody. But here is the MEC of Gauteng, of Health in Gauteng, telling South Africans that they are getting paid. This money that they're getting from these countries. And we know this is totally nonsense. We should not have a sell out like this, who comes in and speak recklessly and lie in front of us. She thinks that South Africa is Timo or Shane. This is not Shane or Timo. This is South Africa. You must put some respect in this country and stop making us like fools. She's making South Africans who look like we're fools. She must show us the countries that she's claiming that they're paying. Guys, we must demand from the ANC and the DA and this GNU, they must show us which countries that are paying. And if they're paying, they must transfer that money to private healthcare and leave this public hospital for the poor people of this country. We cannot accept this. This is nonsense. She comes to a national television and say such things like that. Call South Africans that we are xenophobic. She must tell us what is the meaning of xenophobic in her mother tongue. She must tell us there's no such things like that in this country. When you fight and protect your country, your own people, sellouts, will call you xenophobic. When you fight for your own country. Now Ghana has realized that they need to fight for their country. Ghana is fighting for their country. Sooner or later they'll be calling Ghana xenophobic. There's no xenophobic there. The Ghanaian people are fighting for their country. When people come to their country to come and steal their land, want to start their own nonsense, we cannot accept this, guys. Whatever is happening in Ghana, already it's happening here in South Africa. People claiming our land. I saw similar video in Cape Town. These Nigerians electing each other to be what in Cape Town. And we have this type of MECs here talking nonsense on national television, and we must accept this. We can't accept this. They're paying nothing. I want to play a last clip of a Nigerian who has given birth twice and should confirm she paid nothing. But you have this type of MEC coming here and talking nonsense. We should not accept these things, guys. Such type of MEC must leave her office. We don't want people who's going to work against South Africans. This is our country. We don't have another country. But let me play you the next clip, guys. Let me play a next clip of these Nigerians who has given birth to two of her children in this country. And she said she has not paid anything. But you've got this type of people here telling us nonsense.
Okay, my 2 cents or inputs in this whole health system thing and foreigners in South Africa. Let me give my 2 cents. Let truth be told, South Africa has tried. Let truth be told, South African healthcare system, they have tried. They have tried. If they're saying we can't do it anymore, please, no one should now start getting upset and saying, as South Africans, they're chasing, they have tried. As someone who was in South Africa, who lived, who schooled there, who did some things there in South Africa, I will say, I gave birth twice in South Africa. Twice. I had 2 children in their government hospital via CAS, 2 CAS operation, cesarean. I did not pay 1 cent. 1 naira I did not pay. I did not pay. It was free. I was shocked myself. When I was discharged to go get my discharge and then to go clear my things at the logistic and whatever, we were there to go and pay. They said, no, it's free. We were like, because in my country, Nigeria, it's not free. It's not free. You will pay. Especially CS is even the worst. You will pay so much money. People borrow money. People cry. People even say, no. When it comes to CS, no, my wife will push. My wife will give it as a Hebrew woman because of the payments. It's expensive. I gave birth to the second child. The same thing. I was given food 3 times a day. Free food. 3 times a day. I went to antenatal since it was considered high risk. I start first from the clinic. They did my blood test, everything free. I didn't pay. And from there, I was transferred to the hospital to continue my antenatals there. I didn't pay. Doctors were seeing me all the time when I go there for my consultation. I did not pay. It was free. Till I gave birth, till I was admitted for a week because they were expecting the baby to just, I exceeded my labor dates. So they said, no, they can't take that risk anymore. I should be admitted, monitored, and all those things in the hospital. I should stay there. I stayed for close to a week, more than a week plus. And the baby couldn't come. The labor didn't start on its own. So they said, no, we can't risk it anymore. We have to take you in for operation. They couldn't also stimulate the labor because of my previous seizures. So they had to just go in for cesarean section operation again. And I did not pay. Antenatal, US, everywhere, you pay. Most of the places in the world, you pay. It's not free. I did not pay. I went to Ghana. I moved to Ghana. I gave birth in Ghana. I paid. My children, they're fighting. I'm coming back. So, I was in Ghana also. I paid. It was also CS. I paid for my medical cover, paid for everything. Everything was paid for. I got Ghana health insurance. I also got it all for my children, so that if anything, we can use it. So if South Africa, they're saying they've tried, it's putting a strain on the system. It's too much people compared to the people they budgeted for, which were the citizens, which they carry out their groundworks. They know the number of citizens that are supposed to use this particular clinic. It's okay. Don't get upset with them and say, hey, they don't want it. No, they've tried. They have tried. You know in your country it's not free. You know it. It's not free. You know it. They've tried. What you can do is look for the most affordable, cheapest health insurance you can get. Look for it and get it and use. Or health insurance, the most affordable, the least you can get it and use. I remember when we were traveling to Norway, we were not given, part of the requirements was, even though it was a 3 weeks trip, we got health cover for that 3 weeks, for that duration. You're not allowed to travel without it. You said, no, you must cover yourself. What if you're there and you get sick while you're there? They're supposed to take care of you. So we had all those things when we were traveling. Please, not every time we don't say, oh, it's xenophobic. Sometimes, let's just say the truth. They've tried. They have tried. Okay?
Even a Nigerian, she agrees. Even a Nigerian, she agrees because she knows that we have tried, this country has tried. We have tried to assist not just Africa, the rest of the world. We cannot continue to continue the way things are going. Even the aid is being cut. But you have MECs like this who are selling our country to build their own portfolio, to look good when the country is going down. These people must go get assistance in their own countries. If they want to get assisted, they can use a private hospitals. They must go pay. Everybody must pay. Why are we paying as South Africans? And criminals are not paying. Because anybody who comes to this country illegally, you are a criminal. And not only the criminal ones. We also want the legal one also to pay. It's not only for illegal foreigners. Also the legal foreigners must pay. They must go to a private hospital and go pay. As you heard, she was having 3 mil. She said she paid nothing. This MEC, she thinks South Africa is a banana republic. She thinks South Africa is a charity organization. South Africa is a charity organization. We don't have, doctors are not employed. Doctors don't have jobs. Sooner or later, even nurses, there are nurses who don't have jobs, but you are busy wasting money. Instead of taking care of the doctors, instead of taking care of the nurses. Nurses and doctors were calling on you. When these illegal foreigners come to the hospital, to the clinic, please call the police to come and arrest them because they're criminals. They cannot be in this country not documented, and we keep quiet. If you don't call the police, you are a criminal yourself. You cannot. You are part of these things, this nonsense they're doing. It is a criminal offense not to call the police. You must call the police because if you don't, you are assisting a criminal. Criminals must be arrested and criminals must be thrown in prison and criminals must be deported back to their home country. That's the only way to fix this country. We cannot have this type of MECs here talking nonsense. This is our country. We must protect our country of it. She's busier with a reckless messaging. Because whatever she's saying there on a national television is reckless. It's careless. We cannot accept this. It's dangerous for our country. It is a threat to our national security because everybody will be coming to this country. We cannot accommodate everybody. We are not a charity country. Enough is enough. But these people, they don't get it. They're sellouts. Guys, we must call for this commission of inquiry on these NGOs and these human rights criminals. We want a commission a commission of inquiry on these NGOs that we have in this country and these human rights criminals. The human rights criminals, we must have a commission to deal with whatever's happening there because there's too much allegations there that are happening there. That some of them are being sponsored by criminals, by drug dealers. Guys, we cannot keep quiet. We cannot keep quiet. The human rights criminals must be investigated too. We're calling on Ramaphosa. We want a commission of inquiry also on them. All these NGOs that are here in South Africa, all of them, because they're selling out our country. You heard that MEC, she's busy with the NGOs and these human rights criminals. Guys, I'll see you on my next video. I'm sick and tired of these people.